Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
You know, some people, when they are having a meal, they will think, okay, shall I have for the next meal? I'm having lunch now, but I'm thinking about my dinner. So this thinking will be gone. Our purpose is not just lose weight. We need you to lose weight in a proper way, in a healthy way. Also, some of the patients might suffer from hair loss. Why is that? There is 1 in each 3 or 4 adults are affected with this. It's a disease, so it needs a prolonged treatment.
We realize the value of health only when we fall sick. Good evening, dear friends. Welcome to BMC Global Live Al Hilal Health World, nothing but lifestyle. Today we will be discussing about a trending topic, weight loss medication. And the doctor joining us today is Dr. Mariam Jasim from Al Hilal Hospital, Hamad Town. She is a specialist in family medicine. So doctor, welcome to the show.
Thanks for having me, dear.
So doctor, let's begin with obesity. So how widespread is obesity now?
Obesity is one of the most leading health challenges around the world. There are 1 million people who are affected with obesity. In our region, there is 1 in each 3 or 4 adults are affected with this. Nowadays, obesity is recognized as a chronic relapsing disease. It's not just an excess weight. It's not like bad habit choices. It's a disease. So it needs a prolonged treatment. Also, they've seen that obesity is linked to so many diseases, such as type 2 diabetes, hypertension, obstructive sleep apnea, non-alcoholic fatty disease, and some varieties of cancers. So we need to focus on this topic and we need to treat it so the patient will have a better quality of life. Because they've seen if the obesity is so severe and left untreated, it might lessen the life expectancy by 10 years. We are speaking about 1 decade.
And it will affect the quality of life also.
Exactly.
Yeah. So doctor, how has treatment of obesity evolved over the years?
Alright, so it started with lifestyle modification. By lifestyle modification, we mean restriction of calories or limit the calories with the exercises. Then the pharmacotherapy arises, where they use medication which acts, I cannot mention them because there is a huge list, and will not be our topic today. But the lifestyle modification, where accounts for 5 to 10% of total body weight loss. The medication that would arise earlier, it was account only for 5% when used for continuous 3 months. Later on, bariatric surgery arises, and it is made a huge difference because it accounts for a sustained weight loss and accounts for 20 to 30% of total body loss. And it was there for a long period of time. until these new medications arise. We're talking about GLP-1 and GIP medications. When they arise, they change the game because they are non-invasive, and they also account for almost 15 to 20 of the mean total body weight loss. So we can see in such patients more of this number.
Now you mentioned about the new medications.
Yeah.
Can you explain how these new medications work?
All right, so these medications come in two forms, oral and injectable. Okay, but we will focus about the injectables nowadays. So let's break it down. We have two hormones, one called GLP-1 and the other one is GIP. For the GLP-1 analog, it mimics the hormone called glucagon-like peptide 1. How does it work? It will decrease the satiety in the hypothalamus and the brain. And also it will reduce the gastric emptying, so the food will stay for a longer period. If the food stays in the stomach for a longer period, it will send a negative feedback for the brain, telling the brain that we are still eating, we're still having food. So it will cause more and more satiety. Okay, then the patient also will have more benefit through increasing the insulin secretion inside the body. It will improve the liver function through reducing the glucose secretion and improve the glucagon. Also, it will affect the lipid. It will reduce the distribution of the fat periphery, okay, and it will enhance the lipolysis. So the patient in this case will have less appetite. The food will stay for a longer period. By these effects, the compulsive eating will become less. As a net result, the patient will have less compulsive eating disorder and ideation, and the food noise will be abolished. So he will not think about food. You know, some people, when they are having a meal, they will think, okay, what shall I have for the next meal? I'm having lunch now, but I'm thinking about my dinner. So this thinking will be gone with these medications. So with the dual medication, dual hormone, there will be the GLP-1 effect that we have mentioned earlier. Added to that, the GIP effect. For the GIP medication, it will give more and more suppression for the appetite, and it will increase the insulin sensitivity. So the receptors for the insulin will be sensitized to the insulin that's already secreted from the patient's own pancreas, thus more and more better glucose metabolism. By this means, it will enhance the metabolic rate also. Yeah.
Oh, that's how the medication works.
Exactly.
So, doctor, when a patient presents in your clinic with obesity, how do you decide if he's the right candidate for this medication?
Okay, it's a good question, because, you know, according to the FDA and the American Diabetic Academy, in collaboration with the Obesity Society, they put some guidelines for such medications. There are two main categories. One, if the patient is obese with a BMI more than or equal to 30 and it's classified as class 1, 2 or 3 of obesity, regardless of the comorbidities, he's a good candidate for these medications. Or if the patient is overweight, by mean the BMI is more than or equal to 27 and he has one or more of the following. If the patient's having type 2 diabetes, if the patient's hypertensive or dyslipidemic, means high cholesterol level and high lipid profile. If the patient is suffering from obstructive sleep apnea, if the patient's having non-alcoholic fatty liver disease, which we call NAFLD, or if the patient is female and suffering from polycystic ovarian syndrome and having some issues with the fertility, we can use such medications for them. But if the patients want just to lose weight for an occasion, like if one girl wants to lose like a few kilograms for her wedding, no, it's not an indication for such medication. Or in another term, it's not for a cosmetic reason, because we are treating a disease. We are not just doing this for fun.
And doctor, who should not take this medication? Can you explain that for us?
Yes, thank you. This is a great question. There is an absolute contraindication to use such a medication. For example, anybody who has personal or family history of medullary thyroid carcinoma or multiple neoplastic endocrine disease type 2, these are prohibited to take such a medication, because according to the trials were done on rodents, there were increase in the prevalence of these two cancers. So better safe than sorry. We don't prescribe such medication for such patient. Number two, if the patient have acne, means the diabetes already affected the retina, it's not recommended to use this medication also because it might deteriorate the vision in such patients only. Yeah.
And doctor, how do you decide whether to start these new medications?
All right. First thing first, we ask the patients to come to our clinic. We can assess the BMI by taking the weight and height, calculate the BMI accordingly. Better to check the waist circumference as well because it's more accurate. If it's possible, in some clinic they have a machine that measure the lean mass, which means the muscle mass, because we need an initial numbers to start with, and then we can compare if we go further on with the medications. Then after this, we determine the target. Means the patient, for example, his weight is 100 and we need, according to his height, we need to reach 80, for example. So we calculate how much percentage of total body weight we need this patient to lose. After that, we can choose either the patient is candidate for the dual hormonal therapy or only the single hormonal therapy. For this patient, the example that I've given you, all right, so initially we will monitor the vital signs and the BMI with the waist circumference and the body lean mass. Then we will do for him a baseline labs, including CBC and iron profile, thyroid function test, kidney and liver function tests, HbA1c, fasting blood sugar, and we need to assess also the vitamin D and vitamin B12 as well, with given the electrolytes and so on. So these will be a baseline and we will repeat them every 3 months, all right? Okay. But for the visits, we need the patient to visit us monthly. Why? We want to assess the side effects and we need to assess the number of percentage that has been already lost, so we can tailor the plan. Like, can we be on the same dose, or we can like titrate the dose. After that, we can see if the patient already can eat, because our purpose is not just lose weight. We need you to lose weight in a proper way, in a healthy way. So we don't want you to lose the basic nutritional needs and you lose more weight. What is the benefit of that? Okay, so the patient is tolerating the side effects and he can eat normally. Then after that, we can increase the dose. Please, we always tell our patients, please, dear patients, if you are taking any medication over the counter, multivitamins, herbal medications, if you are on any medication that affect or lower the blood glucose levels, such as insulin or sulfonylurea, you have to tell your doctor. Why is that? Because with such medication, you will not eat probably. And on the other hand, you have medication that lowers your blood sugar, for which we need to weigh the benefits. We always go with this medication when the benefits outweighs the risks. So you have to disclose this information so you avoid the hypoglycemic attacks. Also, if the patient is scheduled for a surgery, we ask them to stop the medication 10 to 14 days prior to the surgery. Why is that? Like anesthesia-induced aspiration, and this is a very, very, very bad complication from a surgery, from a general anesthesia. And for our girlies, any female patient who is in the childbearing age, she is married, and she's planning to get pregnant, please do not be on these medications. You have to stop it 2 months prior trying to conceive. If you want to take this contraceptive, better safe than sorry, because there is no such studies like giving us the safety for using them and the pregnant. And yeah.
Doctor, can you now explain about the long-term and short-term side effects?
Of course, every medication has a side effects. With this specific medications, there is a short-term side effects which are dose-related. So the patients might have nausea or vomiting, abdominal bloating or discomfort, diarrhea or constipation, headache or fatigue. The patients mostly will have it on the first days of using this medication and when they titrating the dose. Also, some of the patients might suffer from hair loss. Why is that? Because if you lose if you rapidly lose weight, this will like make a stress environment in your body. So there's a condition called telogen effulvum will happen there, where the hair is shedding. Okay, so this is explains why the patients having hair fall with this medication, because they will lose weight rapidly. All right. Also, on the long term, the patient might have, not all of the patients, but these are according to the studies, we are stating facts. For the long-term therapy, some of the patients might have gallbladder stones because of the rapid weight loss. And this is not only specifically to this medication, because as we mentioned earlier with the hair loss, also gallbladder stones happens when the weight is lost rapidly. Second thing, infection of the pancreas, which is called pancreatitis. And last thing, which they found it in the rodents, not in people, but also we have to mention this, better safe than sorry, thyroid medullary carcinoma or MAN type 2.
Doctor, suppose the patient reaches his goal weight. Can he stop the medication? How can he manage it?
It's a very challengeable in this, especially in this medications, because according to the studies, they do 2 trial studies, and they found that the patient regained their weight after stopping such medication. Because as we mentioned earlier, obesity is a chronic disease, so we need to treat it for a long period. However, this is a theoretical part. However, in a practical part, we've seen and witnessed a very successful journeys for a patient where they stop this medication and maintain the results. Why is that? Because they have implemented some changes in their lifestyle. So they did lifestyle modification, they were sustained training and healthy diet habits. With these are the foundation. They have sustained results and wonderful results, and nowadays they are living happy and they can maintain their weight loss, and they even lost more of weight naturally.
Doctor, I have heard that this medication helps beyond weight loss. What's your suggestion?
That's correct. Firstly, they invented such medication to treat patients with type 2 diabetes. Their aim was to reduce the A1C by 2%, which is the highest among the hypoglycemic agents. But with the usage of this medication, they found that it caused weight loss, for which they promoted for weight loss, treating the obesity. Okay, then with the more usage of this medication, they have found that it is cardioprotective. It will reduce the cardiovascular attacks in non-diabetic adults, and also it reduces in the diabetic patients. Also, they found that it is renal protective. By this, we mean it will reduce the albuminuria, and it will give a good protection for the kidney in type 2 diabetic patients. Also, they have found that with its metabolism effect, it enhances the liver function. Also, it improves the sleep pattern, especially in patients with obstructive sleep apnea. Speaking about fertility, they have found that in women who are suffering from polycystic ovarian syndrome, have achieved or improved the fertility because of its anti-inflammatory effects and because of reduction of the weight, improving the insulin sensitivity, and thus improving the fertility in these patients. But of course, we always advise them, do not take this medication while you are trying to conceive. Also, they found in osteoarthritis, it has improved the cartilage health and has an anti-inflammatory process or function which reduces the pain. And lastly, they found that this dual medication, both of them I mean, have crossed the brain-blood barrier, and they have an antioxidant effect. Theoretically, they've said that it might reduce the incidence of Alzheimer and Parkinson disease.
So these have so many advantages also.
Yeah, alhamdulillah.
And doctor, what are the red flags the patients should watch for?
The patient should watch out for severe abdominal pain that does not go, plus minus severe vomiting. So by this, we want to rule out acute pancreatitis or gastroparesis. Second thing, if the patient feel like difficulty in swallowing or swelling in their neck, pain at the neck, they need to seek medical advice. So we need to rule out the thyroid carcinomas. Also, the patients have to watch out if there is yellowish discoloration of their skin or sclera. Alright, so we can rule out the gallbladder stones. And also we advise the patient to avoid being dehydrated because we don't want the kidney to be affected through the dehydration caused acute kidney injury. And if there is any deterioration in the vision or in the mood.
And finally, doctor, what is your advice for patients who intend to go for weight loss medication?
All right. So if they cannot eat it from protein, sometimes we turn muscle on this medication. Second thing, to stay hydrated as much as they can to we prevent the kidney injury. Also, we advise them to try to avoid the greasy, spicy food as much as you can to minimize the side effects and have good sleep. And always seek medical advice when needed. And also for females, one more time, if she is trying to get pregnant, please avoid taking this medication. If you want to take it, you have to be on contraceptive and to take this medication because we cannot guarantee anything.
I know, doctor, can you speak about the services you offer in Al Hilal Hospital, especially in your Hamad Town branch?
So in our branch, in my clinic specifically, we offer services throughout all of the years, starting from 2 months old until the golden age. We will cover the whole family, for which it's called family clinic. We will offer a child screening services, vaccination services, premarital also services, and pre-employment. Soon we'll be launching the new service called Weight Management Clinic along with the NCD clinic. NCD stands for non-communicable disease, where we'll be treating hypertensive people, diabetic patients, dyslipidemic, asthma and gout.
Thank you, doctor. Thank you once again.
Thank you for having me, dear.
So viewers, I hope this was a very informative episode. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again with a new doctor and a new topic, this is Jessila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.